It's time for On Point, where we speak to experts to delve deeper into some of the key issues in the spotlight right now. While South Korea's current wave of COVID-19 infections is on a decline, South Korea's top health officials said on Tuesday that the country will be seeing an increase in the rate of infections following the long Chuseok holiday.
He's also warned of a potential twindemic when COVID-19 and seasonal flu start spreading at the same time. So what does this mean for the country and what can people do to protect themselves? We have Seungtaek Kim, head and professor of Zoonotic Virus Laboratory at Institut Pasteur Korea with us today. Good morning, welcome back.
Good morning.
First, the rate of infections, according to the health agency, is set to go up temporarily. How serious will the spread of infections do you think is going to be?
Well, as you mentioned, after the Chuseok holidays, many people just get together from many parts of this country, and then they share food and then chat, and this is really just a good situation for viruses to transmit. So as officials said, that we have observed the less than one basic reproduction number for the last couple of just weeks. So we may see a surge of some COVID-19, but may not the huge surge. But we do not know for sure how just the magnitude of this surge. All this is just caused by at this moment we do not see any more just a variant. So that most of this magnitude will be determined by our behavior. So we will see.
And Professor, South Korea saw the worst of the pandemic earlier this year, and are people that were infected then, like Toyon and myself, actually now at risk of reinfection?
Right, exactly. And people who are talking about some reinfection, I have to tell just a little bit about just immunity that we actually just raised after, whether it is a vaccination or just a natural infection. There are two aspects of immunity. One is antibody generation, and the second one is cellular just immunity. So the key factor just regarding some reinfection is the actually neutralizing antibody that we actually raised against these viruses. So based on all the clinical evidences and then any data that we have actually observed in the past 2 years is that after actually a couple of months after infection or just vaccination, our the chance of reinfection is actually increased, and that's mostly due to some waning immunity, mostly due to some waning titer of neutralizing antibody. So basically, we can be very vulnerable to reinfection, but the person by person, there might be some differences. But the good thing is that cellular immunity is very long-lasting and then very robust. So even just after reinfection, if we got the immunity, whether it is by just infection or just vaccination, we will still be well protected from some severe COVID-19.
Right now, turning over to twindemic, as we have just reported, has the world ever seen something like this in the past? I mean, COVID-19 is definitely a new virus, and what can we expect? When can we expect it to begin?
I think the term twindemic was just coined. I mean, after this COVID-19 pandemic, and also we have in the past we experienced some flu pandemic. Like 100 years ago, we experienced the Spanish flu, and some decade ago, we also observed the flu, another the flu, just a pandemic. So the term twindemic was actually coined after this the flu pandemic and also this COVID-19 pandemic. So, but this twindemic is not, this world was actually just circulating even just 2 years ago. And then the people concerned that when we are approaching the fall or just the winter season, there might be some double infection, like COVID-19, also just the flu infection. The flu is normally just we experience in the fall and the winter season. And there was some concern, but the number of cases was not really just not many so far, because people are just get used to just wearing just the masks because of the some personal behavior and hygiene. So we did not see just many the double infection cases. But then there was some small cases, for example, like COVID-19 and plus just a respiratory syncytial virus infection. And also, this is the human case, and then also some in animal experiment, there was some COVID-19 plus some influenza virus infection. The number of cases are very small, but the scientists actually just observed maybe the symptoms, the prognosis was really just worse compared to the single infection.
And well, Professor, how can the country really prepare for the twindemic then? Is the current medical system able to withstand such pressure?
Well, the concern is that most of the death, I mean, especially for the COVID-19, we actually observed that most of the deaths occurred in some unvaccinated person and also elderly person, and then the immunocompromised patient. But the good thing is that for the COVID-19 and then the flu, we have very good, just very effective vaccines and then drugs available. So for the preventive measures, I think just a vaccination for just COVID-19 and the flu are very highly just encouraged. And especially for some very vulnerable people, including the elderly and then the immunocompromised people, we are actually just encouraging just wearing masks during the fall and the winter seasons.
Right, and people can't wait until they get their masks off, but it seems like we'll have some time before that with the fall coming. Well, thank you so much, as always, for being with us this morning. It's always a pleasure to speak with you. Hope to speak to you again soon.
Thank you.